When your surgery is complete, you will be taken to the recovery room for at least 1 to 2 hours to begin your postoperative care. We will monitor your vital signs, ensure you wake up comfortably and are stable after surgery. Once you are awake, you may begin chewing gum to help stimulate and wake up your bowels after anesthesia. After you wake up and meet the recovery room's criteria for discharge, you will be transported to your private room where you will spend the remainder of your hospital stay. Your family member or support group will be informed of your location. Please ask our office for the most up-to-date visitor policy. It's important to know what to expect during your recovery in the hospital, so we've put together some frequently asked questions regarding your stay. Due to the anesthesia, all patients have the potential of experiencing some degree of nausea for the first 24 hours following the surgery. If you experience stomach discomfort, speak with your nurse who can provide nausea relief medication. Shoulder and back pain can be caused by your body's position during surgery and should improve after a few days. It may also be the result of carbon dioxide gas used in the robotic-assisted procedure radiating to your back, shoulders, abdomen, or chest. Abdominal pain can also be the result of gas buildup or even from your incisions. This is all normal discomfort and is typically controlled with pain medication or even Tylenol. However, you should always report any excessive discomfort to your nurse, as it could be caused by something more serious. Immediately following the surgery, you can have small sips of water. For the remainder of the day, you may drink clear liquids, including broth, popsicles, tea or coffee without milk or creamer, Jell-O with no fruit and Crystal Light. The next morning, you may follow a regular, solid, portion-controlled diet. Carbonated beverages, red meat, or fatty foods are permitted only after your first bowel movement. Keep in mind, though, your diet may change based on Dr. Patel's recommendations. Bladder spasms can occur following surgery and feel like cramping sensations in the lower abdomen or bladder. These spasms are caused by the stimulation of the bladder by the Foley catheter and usually subside within 24 hours. You are given medication in the recovery room to help control the spasms, but if they continue or are severe, notify your nurse. While you are asleep in the operating room, a Foley catheter will be placed into your bladder through the penis to drain all of your urine. This will be left in place 4 to 6 days following surgery, unless otherwise specified by Dr. Patel. A small amount of oozing around the catheter site following a bowel movement or ambulation is normal, and you can use a small pad to soak up the leakage. You may also notice a few small clots or pink tinge to your urine, which will also resolve. If it worsens, notify the nurse. You may also experience some friction where the catheter enters the penis. Apply water-based lubricant around the site to reduce rubbing on the skin. Ensure that the catheter is not stretching or pulling by checking that the clamp on your leg is not too far down when you stand up. If it is, notify the nurse. If you notice that the urine is coming out around the tubing onto your underclothes and very little is draining into the bag, check to see that there aren't any kinks in the tubing and notify your nurse. You will be given an incentive spirometer to help expand your lungs after surgery. You will be taking this home and it is to be used until your catheter is removed. The goal is to have you up and walking within 4 hours after surgery to help reduce the risk of blood clots. You will also wear tight white stockings and sequential compression devices in bed at all times to help maintain blood flow in your legs. The compression devices are sleeves that go around your lower legs, which inflate and deflate to simulate walking while in bed. Dr. Patel will provide specific instructions to your nurse as to what medications you need during your stay. If you have any questions as to what you are being given, please ask your nurse. During your stay, nurses will assess your recovery progress, check your vital signs, and monitor your fluid intake and output every 4 hours. Lab tests will also be drawn daily. You may shower the morning after your surgery. Your incisions have glue over them, allowing you to shower with soap. But be sure not to scrub off or remove the glue. Pat them dry after showering. Prior to your discharge from the hospital, you may be given prescriptions for pain medicine, a stool softener, and an antibiotic. We send these prescriptions down to our pharmacy in the hospital lobby, where you can pick them up when you leave the hospital. Before you are discharged, the nurse will instruct you how to care for your catheter at home and demonstrate on how to change from a large to a smaller, more discreet catheter bag for out-of-home use. If you have a long drive home, Be sure to stop at least every 2 hours to walk around and get circulation in your legs. Review these preoperative instructions until you feel comfortable. If you still have questions, do not hesitate to contact our office. Thank you.